13 years ago, I found myself in the intensive care unit at the University of Pennsylvania, where all of my organs were shutting down. My liver, my kidneys, my bone marrow, my heart, and my lungs were all not working. And after the course of about 7 weeks of no diagnosis, no idea what it was that was killing me, my doctors came into my room and they said, "We've tried everything. There's nothing more that we can do." I knew that my only chance of survival would be to unlock an existing drug that could be repurposed for me. Now, I knew that was possible because many diseases share the same underlying problems and can therefore be treated with the same drugs. And of course, since I didn't have 10 years and $1 billion to develop a new drug from scratch, I knew my only chance would be to see, is there an existing drug that's sitting on the pharmacy shelf that could maybe save my life? So I began performing experiments on my own blood samples. At the time, I was a third-year medical student, and began testing to understand what were the immune cells that were highly active and what was going on in my particular disease. They can be utilized and effective in individuals dealing with autism. And so this is just one example, and I'll go through more in my talk, where a drug was intended for one condition. So sirolimus was intended for organ transplant rejection, and now we're using it in Castleman disease. We treat patients all over the world with sirolimus. And it's amazing how many drugs actually already have clinical data and evidence to suggest that they can be helpful, yet they're not utilized at all around the world. And so I just think about all the individuals who are suffering when there actually could be a treatment that could be helpful for them. Oftentimes we think about FDA approval as being sort of the final goal that we should go for. And I really disagree with that. I don't think you need to get FDA approval for an existing drug in a new disease area. 20% of all prescriptions that doctors write every day are what are called off-label, so they're not approved for that indication. So weigh the strength of evidence between every drug and every disease. It's a total of 60 million scores for every drug versus every disease, and then let the algorithm tell us what is the drug-disease combination that's most likely to help a patient. And let's go do a clinical trial of that. So it's completely disease agnostic.